That's for me, and that's for you.
So hello and welcome to you all. Thank you very much for joining us here in Brussels, everybody in the room, and everyone who's joining us online too. Or perhaps you're watching this recording later. We're live, I think, a great team here to celebrate EU Flu Day. It's the 4th time that this event has been run, but it's the very first time that it's been held here in the European Parliament. The theme for this year, empowering healthcare professionals for everyone's protection. EU Flu Day is organised by the Steering Group on Influenza Vaccination, and that's a group of academics, of clinicians, healthcare workers, scientists, industry, civil society, all advocating for the increased uptake of vaccinations against seasonal flu. And what is going to be very exciting today is we're going to have the revealing of their policy recommendations. So stand by for that. And we very much want your participation. To those who've come to listen in the room, you can raise your hands and we will take your questions in the room. For those of you joining us online, you can submit your questions on the live stream, the WebEx that you're on. We very much want you to spread the word about EU Flu Day. Please use the hashtag EU Flu Day on all your social media and tell everybody about what's been going on here today. My name is Sue Saville. I'm an independent health and medical journalist, former medical correspondent at Britain's ITV News, and delighted to be guiding these discussions today. So why are these discussions so important? Well, it's because vaccine confidence, although generally high across Europe, has lapsed in some areas. There are some exceptions, and there have been some declines in the perceptions about the importance, the safety, and the effectiveness, indeed, of vaccines in some areas. We want to address this. And despite the European Commission, the ECDC, that's the European Centre for Disease Control, and the World Health Organization issuing a joint statement which called for vaccination against influenza and COVID-19, the implementation of that dual programme has at best been inconsistent. Action is needed if Europe is to meet its target of 75% vaccination. And that was set back in 2009 by the Council recommendation on seasonal flu vaccination. Now, healthcare workers have a key role to play in reaching that target, because, of course, they are a trusted source of information for patients, and whatever their attitude is to vaccination can significantly influence the patients that they speak to. So, over the next hour and a half, we're going to hear from the European Commission's DG Santé on the current state of play with seasonal flu vaccination across Europe. We're going to learn more about why healthcare workers in particular are so very important in targeting increasing vaccination rates. I'm going to hear the steering group's policy recommendations. Stand by for those. We're going to have a panel discussion and we will take your questions. We want to know what questions you'd like to put to these top experts. So everybody who has the chance to speak, remember to click your microphone on and then off again when you finish speaking. That would be great. Now, we're very honoured to be the guests here today of 2 MEPs. Thank you very much indeed to István Ujhelyi, who is from Hungary, and to Dolors Montserrat of Spain. Thank you very much. Our 2 MEPs are going to bookend, start and finish our discussions today, and we're delighted to be guests of you here at the European Parliament. Thank you very much indeed. So, István, over to you for your introductory remarks, please. Thank you.
Thank you so much, dear guests, and of course, dear host, colleagues. You have to know that I'm one of those MEPs who would like to be very active to support the public health services and policies here in the Brussels bubble. It's not easy. When I started my political career here 9 years ago, nobody wanted to speak about the health policies because it's a member state competency. We don't have to care about it here. And believe me, we have had so many changes, and it's good. Only this week, only these 3 days, yesterday I had, I think, 3 or 4 kinds of events related to the health issues. For example, with Bear and with Daniel, we had this, in the same room here, we had one excellent time to speak about the nurses, how we can support the associations of the nurses. Today we had an action. Maybe you could realize it. There is a screening bus outside from the parliament, and I made it. It's a liver cancer screening bus. I'm okay, so I can drink a beer this night. 1 hour ago, I went because we have organized by the Red Cross. We have a blood donation, so I did the same. Now we have this excellent event to speak about the flu and the vaccination, and immediately after that I have to go to London, organize a big health event by the Economist. So it shows that there are more and more events, which is good for us. I told to my friends and my colleagues and my partners, associations, stakeholders, several times, we have to make the noise here in Brussels, in the institutions, because the health is for our societies. It's not a local council issue, not a government issue. It's an issue of the family's future, and we have to serve them from this level and from the local level. So that's why we are here. And you asked me as a host to have a welcome speech. So of course I will have it, but I just wanted to tell you till the next June, I'm ready to be again and again manage and to be host more and more events because we need the lobby here in the parliament and also in the other institutions. Of course, you know very well how important is the vaccination. Can you imagine during the COVID-19, I had 2 main issues. I'm first vice chair of the Transportation and Tourism Committee, responsible, for example, the tourism industry. And my other big issue is the health as one of the initiators of the European Health Union program. So during the pandemic, it was very interesting for me because because of the pandemic, we had to work a lot and fight a lot to support the health systems, surveys, to speak about and fight for the vaccination all over in Europe. And it was very interesting combination between the tourism, transportation, and the health issues to establish and to create our new, I think, very important vaccination service and the digital pass for all of us in Europe. It's a historical moment, thanks to the COVID. But today we are here to support and to speak about the professionals in the healthcare services, nurses, medical doctors, pharmacists. How can we ask them? How can we support them to try to organize stronger campaigns about the vaccination? because also in my family, my parents are doctors, so I don't have to push, for example, my mom. But all the other part of the family has just started to be tired after 1, 2, 3, I don't know how many vaccines. But after the pandemic, we forgot the normal yearly flu vaccination. And that's why we need some kind of campaign all over Europe, because the flu is here. Maybe we can say we won the battle against the COVID-19, but we will have more and more kinds of viruses, and we have every year here the flu. So that's why I'm here, and that's why I really would like to be your partner, your supporter, and I really thank the organizations who organize finally and again in-person meeting the EU Flu Day. Like yesterday, Zoltán, my excellent colleague, you know him, he wrote me a fantastic speech, which was very important for me to learn. But maybe it's not useful to read it to you, because I think most of the guests has a deeper information about the flu vaccination and about the data than me. So always these speeches are very, very good to read it, to be prepared, and not to tell it to you, because I arrived not only to be host, but also to be a student and some kind of activist in your movement. So thank you so much, and have a nice day.
Thank you very much indeed to MEP Ujhelyi. Thank you for those introductory remarks. I'm glad to hear that you've got doctors as parents, so you've been set on the right track there.
I'm a doctor too, but a lawyer doctor. Maybe it's not the best and most important today.
It still counts, it still counts. So I think to set the scene, we need to know where we are at the moment with flu. And indeed, one of our speakers actually said, well, should we even define what flu is? And I might leave it some of the medically minded to do that one. But it would be really helpful now to know, what about in Europe? What's vaccination uptake like? So to set the scene for us, I'm delighted to hand over to Isabel de la Mata, who is the Principal Advisor for Health and Crisis Management at DG Santé. What's going on in Europe at the moment, Isabel?
Thank you very much. The main issue that is happening in the European Union now, if you don't know, is that on Monday, the ECDC finally published the document that everybody was waiting for about the rates of vaccination, coverage of vaccination, and also how the pandemic has been going in the last year. The pandemic, sorry, the influenza prevalence. So but now we are approaching the winter season, and the respiratory viruses are back. Not only the influenza, the COVID, and also the syncytial, respiratory syncytial virus. So this is nothing very special. Every year we have the same thing. What is different, or what is being different in the last year? I mean, 3 years ago, 3 winters ago, we were not allowed to move. We were wearing the mask. We were not allowed to touch. So this, in this case, there is no hard science. We don't touch. We don't move. We don't respire, we don't breathe the same air than the others, very little influenza. Now we begin to move, to travel, to touch, not wearing masks, and etc. Influenza is back. So this is nothing very, as they used to say in Belgium, c'est pas sorcière. So, how we are responding, or what we are doing with that. So the first thing that is clear, at least for us, for the European Commission, is that we need to know what is going around. And for that, we need to sustainable detection and surveillance systems. This is what we are investing more on that. So we need to know how the data are going, how the figures are going up or going down, yeah, and where especially. So we need to, in order to act, we need to know. Without anything, without any reporting, we in our radar, we cannot have the accurate epidemiological picture, and we cannot say how we will need to react. And this is why with the EU for Health, we have been allocating 100 million euros for the fortifying the national surveillance system. So we are working with the ECDC, yes, but we need to work with the member state. You said it's not only member state responsibility, but it's also member state responsibility. And we cannot tell them, you need to do that, leave them alone. We need to support the member state. So 100 million for that. So regarding the surveillance, also what the ECDC has recently proposed, and we are supporting, the Commission is behind the ECDC in this area, is enhanced testing for the seasonal influenza. And this is also because we have the avian influenza going around, and you have seen that in different countries this is going up, and also several episodes of avian influenza in mammals. So it's bridging the gap. It's going to other animals, and we need to be able to detect when we have seasonal influenza and when we have avian influenza, differentiate between both of them, and additional epidemiological investigations. So surveillance, second is vaccination. Of course, I mean, the Commission has always been behind the vaccination, not only for influenza. We had the Council recommendation that we proposed, even if the member states approved in 2009, and establishing targets, that the member states established targets on vaccination on vulnerable groups for influenza, but we then had the Council recommendation of 2018 to strengthen the vaccination of everybody in general and for more vaccines. The target of the 2009 was 75% for the vulnerable groups, and now we have the results of the study of the ECDC, and I have here the data, of course, and the data. Well, we always say that we can put whatever you want in the middle. At the end, everything has to be positive. So positive, we are doing well, but there are countries that are doing better than others. So the good news is that the ECDC did a survey, not with all the member states, but with the ones that answer the study that they have been doing. Almost everybody has a recommendation to vaccinate the over 65. That was the main vulnerable group. Many countries have recommendations to vaccinate the children. Almost nobody has recommendation for the pregnant women, and for the chronic patient, well, they are, but not yet. So if we, if we look at the coverage for the over 65. The data that we have is that the median is 59%. So we're still far from the 75%. So we can say that we are better. We are better than we were in the season 2018, 2019, because at that moment it was 51%, 59%. We have increased 8 points. Is something. It's good. It's good. We have improved, but still something to go. 75% in the over 65. If we check in all the adults, the adult population, so over 18, the median is 20%. 20% is quite low, but it's true that we didn't ask for that in the council recommendation to vaccinate all the adult population. But I mean, we were implying that it's better that you vaccinate more of the population and not just the 65, because like that, I mean, you not only protect them, but you protect the rest of the population. But what is the problem? Or what is the issue? The issue is that 20% is the median, and we chose carefully with the ECDC not to have the mean, because then we don't know what is inside. But this median means that we have the data from 6% to 27%. So 6% is really low, and if for the 65 plus population, this is even worse. I mean, the range is wider. We have the median, remember, that was 59%, but it's going from 4.5%. I'm sorry to say just like that, 4%, so nothing, to just 75 and higher. So we have some countries that are the winners, the champions, that they are doing quite well. But as I said, is still to go. You have the document of the ECDC in the web, published. I mean, the date is 9th, but in reality it was published yesterday, so it's quite recent. So what else? We have been doing? So we say that you need to vaccinate. You need to encourage our population to vaccinate, but we are also making the campaign. We are working with WHO. We are working with the ECDC. We have prepared a press communique, and the European Commissioner, Mrs. Kyriakidis, has already said targeted influenza vaccination campaigns should be planned to reach the most vulnerable, and including the option to combine vaccination with COVID-19 booster. You had mentioned, I don't know how many vaccines of COVID or booster. I had on Friday my 5th one. So yes, we need to vaccinate. We need to continue to do that. The issue with the combined vaccination is that maybe you miss some days. So the COVID vaccine is already there. The influenza is already there, but the vaccination campaign in many member states will begin in 2 weeks. If you wait to have both at the same time, you will miss some days that could be crucial, because there is a lot of COVID going around. We had the good news of the RSV vaccine that is of use, especially in small children, and that is not something that could be very, very severe on itself, but it's adding, and it's better to prevent as much as you can. So we had last week the meeting of the new public health group, expert public health group that was established last year, and with the subgroup on vaccination. And apart from comparing the situation and checking best practices and etc., there was also the presentation of the project on overcoming obstacles to vaccination, where each one tried to learn from the others. We know that it's not enough saying please vaccinate, but that we need some.
Isabel, I'm sorry to cut across you. The lights have come on. That was a signal from somewhere. Thank you very much for setting the scene, and it's lovely. Perhaps we could delve further into some of the more facts that you got when we take the panel and the questions, but it's really helpful to get that idea. And my gosh, what a range, 4.5% to 75%. That's a huge range across Europe. So thank you very much to Isabel de la Mata for setting the scene for us there. Thank you. So as Isabel was saying, in order to act, you need to know. So now we know the statistics, the urgency of this. How do we act, and what role for healthcare professionals? and indeed, perhaps a little bit on what flu is in terms of differentiating, because Professor Colin Russell knows about these things. He's with something called ESWI, which actually stands for something like the European Scientific Working Group on Influenza and Other Respiratory Diseases. Viruses that got knocked off the acronym somewhere. A member of the steering group on influenza vaccination. Colin, over to you.
Thank you very much, Sue. And unlike our colleague from Hungary, who had a prepared speech and spoke beautifully anyways, I am speaking on behalf of the steering group, and I've been asked to communicate some very specific information. So I'm going to be working from a script. So it's a pleasure to speak to you today on behalf of the steering group on influenza vaccination, and specifically to talk about the importance of vaccination against seasonal influenza, what it can do at both the European and national level, and how we can all be working together to reduce the burden of flu in Europe. The steering group on influenza vaccination is a multi-stakeholder group that includes academics, policymakers, patient group representatives, healthcare workers, clinicians, scientists, industry representatives, and civil society. We are a broad group who attempt to take a broad view on the issue of influenza vaccination. And fundamentally, we work together to increase awareness of the risk posed by influenza, and we advocate for the increased uptake of influenza vaccines in Europe. And as the COVID-19 pandemic revealed, we have many tools for combating respiratory viruses. And so maybe a question to pose at this point is, why are we speaking so much about vaccination? Well, the answer is simple. While we do have many valuable tools, prevention remains our best option. And one of the best tools that we have to prevent influenza and other respiratory virus diseases is vaccination. And so hence, on this EU Flu Day, we talk about vaccines. So today, I'd like to briefly highlight the benefits of flu vaccination and then delve into our policy recommendations. So the ECDC, as we have just heard, estimates that up to 50 million people in the EU are infected with flu every year. And while that statistic alone is startling, there are many other ways to think about the burden of flu. So of these 50 million people, tens of thousands of them will die. And these, to a certain extent, are preventable deaths. Beyond the deaths, we will lose tens of millions of workdays. And we also have a significant burden on our healthcare systems, all associated directly with influenza virus infections. So vaccination against influenza is cost effective, and it is effective at preventing infections, saving lives, and maintaining economic activity every flu season. Because as we've already heard multiple times, flu comes back every single year. So fundamentally, vaccination is about reducing risk. It's about reducing risks for individuals and for reducing risks to society. So increasing influenza vaccine uptake across the EU is essential for EU health systems, not only to be more resilient, but also to be more sustainable. Maximizing resilience and sustainability of healthcare systems is imperative, particularly in an era where we have an increasingly aging population and we confront new health threats. So I suspect that COVID-19 lurks a little too fresh in all of our memories and simply highlights some of the important challenges that we face going forwards. Now, influenza vaccines are a valuable tool for our healthcare systems. And as the well-worn saying goes, prevention is better than cure, and hence the emphasis on vaccines today. And really, prevention is better for both individuals, and it's also better for healthcare systems because it keeps people out of the healthcare system in the first place. So on this year's EU Flu Day, the steering group on influenza vaccination is issuing our recommendations under the banner of empowering healthcare professionals for everyone's protection. Every patient-facing member of our healthcare systems, this is doctors, nurses, and pharmacists, have an essential role to play in administering vaccines and in educating people on the benefits of vaccination for them and their loved ones. This is particularly important in a time of increased vaccine hesitancy and misinformation. Our recommendations aim to do the following. We want to enable healthcare workers to inform, support, and educate people about vaccination. We want to encourage people to get vaccinated and reach the EU's 75% flu vaccination target for elderly and other at-risk groups. And we ultimately want to boost protection against vaccine-preventable diseases in general. So, as we all know, health responsibilities are mainly at the level of member states. However, there is a lot that can be done at the EU level. And this is why we have split our recommendations to address both. So we have 5 recommendations to local, regional, and national governments. The first, on education, is to update university curricula to include relevant training on immunization and communication skills. It starts with the doctors of tomorrow. Second, on awareness raising, we need to develop easy-to-use information materials for healthcare professionals to use with their patients to inform them not only about the risks of influenza disease, but also about the potential benefits of vaccination. Third, on a dialogue and collaboration level, we need to facilitate forums for discussion and provide support for healthcare worker associations. This should include support for immunization projects and regular consultation of healthcare worker associations in health policy decision-making. Fourth, to run awareness-raising campaigns targeting healthcare professionals on the importance of immunizations in general. And finally, 5, to expand vaccine delivery channels to facilitate access. This could include, for example, enabling more categories of healthcare workers with the appropriate training to administer flu vaccines. In short, by following these recommendations, member states can facilitate necessary awareness, collaboration, and access to channels that are available to maximize flu vaccination uptake. While health is not primarily a European responsibility, the Union's role in policy area has steadily grown in recent years, especially since the COVID-19 pandemic. And that is why we are also issuing 4 recommendations to EU-level institutions. 1, the EU should provide guidance and encourage member states to address the skills gap on immunization in the health workforce. 2, the EU should establish a platform for sharing best practices between healthcare professionals and between member states. As we know, flu vaccination rates vary over 65, for people over the age of 65 in the EU, from over 75%, which is meeting the target, to less than 10%. There is clearly know-how to be shared to reduce these staggering disparities. So third, the EU institutions should work with the ECDC and WHO to provide timely evidence and data to support member states on policymaking on immunization and training for healthcare professionals. And finally, fourth, the EU should also use its policy tools to raise awareness on the importance of immunization at the regional level. Taken together, these EU policy actions would provide tremendous support to national and regional governments in their efforts to meet the agreed targets on flu vaccination for increased risk of people who are at risk of severe disease, particularly in the context of flu. It's worth taking a moment to reflect on the fact that the EU Council's recommendations setting the 75% vaccination target for at-risk individuals was set in 2009. That was 14 years ago. And yet, as of last year, only one country, Denmark, had succeeded in meeting this target. At the risk of being a bit blunt, we are simply not doing enough. We have the power to better protect our people and our healthcare systems now. We can simultaneously save lives and money by increasing influenza vaccination rates. Failing to do so is a massive missed opportunity. I am fundamentally optimistic, despite some of the comments so far, that the severe disparities in flu protection across EU countries can be greatly reduced over time, but this will require substantial effort. While it is true that the capacities of health systems differ markedly across countries, the fact that flu vaccination is cheap and does not require exceptional infrastructure is incredibly important. So to sum up, one critical step to boost flu vaccine uptake is increasing political will to make influenza vaccination a priority. EU policymakers have an important role in building that momentum across the EU. And on that note, I conclude, and I thank you for your time and attention, and I very much look forward to our discussion.
Thank you very much indeed, Professor Colin Russell. Thank you for that overview. Gosh, you packed a lot in there.
I'm so sorry, but as you know, I have to leave because I have a big event where I am the host together with the mayor of Seville from Spain. So I'm really sorry, but I have to be also there.
That's quite understood. We are very grateful that you are our
day.
host here today. Thank you for your introduction and goodbye and good luck. Thank you very much to our MEP host. Thank you. So now we're going to hear from 4 more speakers who have a stake in all of this, one by one, and then we're going to open up to a panel discussion because already Isabel, Colin have put so many interesting facts and figures and ideas in front of us. We need to tease these out a bit to see what improvements can be made to improve those margins on the statistics. First, I'd like to introduce Emily Karafilakis, who is sitting next to me here, European research lead at Vaccine Confidence Project, which I understand is the very first in the world to map and monitor vaccine confidence. We heard from Colin there, he touched on vaccine hesitancy. So what's your take on the situation with the confidence at the moment?
Thank you. So we've been monitoring vaccine confidence levels for vaccines in general, but also for influenza vaccination across Europe for a number of years, together with the European Commission. So we've been looking at how it's changing and how it is today. So the latest data that we have is from 2022. And what we see is actually quite positive in terms of confidence in the general population. So there's been quite a lot of increase in people's perceptions of confidence in safety and importance of vaccines, of influenza vaccines, especially when you compare it to other vaccines. And if you look at healthcare professionals, which is one of the main topic of today's meeting, again, the situation is not so negative. It's quite positive. Most healthcare professionals in most European countries are quite confident in vaccination, in influenza vaccination. The problem is when you start to look more specifically at different types of questions. So not only whether they're confident, but whether they recommend it to their patients. And that's where you're starting to see differences between countries, with some countries, for example, having very low rates of recommendations to pregnant women. And as mentioned before, that's in part due to the lack of clear recommendations coming from the national level. But clearly that influences then your confidence in the general population, because healthcare professionals are one of the most trusted source of information for patients. So that's a really key element. And one of our recent study as well, done as part of Immunion, the Immunion project, has shown that it's not only about whether they're confident and recommending it, but when you ask healthcare professionals whether they feel confident enough to speak about vaccination, to answer their patients' questions about vaccines, only about 30% in a pilot study we did in Flanders in Spain, only about 30% are confident enough. And when you ask whether they feel like they've had enough education in vaccination, only about 5% say that they do. So this is where one of the key issues are. It's not about pointing the finger at the people are not vaccinating. It's not about pointing the finger at healthcare professionals that are not recommending. Clearly, there's some important policies that we need to put in place into each of these countries to make sure that they have the adequate training, both in terms of vaccination and in terms of communication. And in that same survey, we found that 95% of healthcare professionals are willing and would like to get more training on this subject.
Well, thank you very much indeed, Emily. My gosh, that's quite a stark figure you gave there. Only 5% feel they've got enough information. So I think we're going to be able to come back to that one. Another on our panel, sitting next to me this side, Susanna Palkonen, Director of the European Federation of Allergy and Airway Diseases Patients Associations, luckily abbreviated to EFA, a member of the steering group. What about from your perspective, from the patient's perspective, where are things now? What needs to be done?
Thank you very much for that question. So we are EFAs representing part of the vulnerable groups because our members have as their members patients with the asthma and COPD, and for them catching influenza is actually extremely dangerous, and it can lead to severe exacerbation, which can lead to a very long decline in their health. And so this is really one of the key vulnerable groups, alongside with other patients with chronic diseases. And I was really not very happy to hear this about this 4%. And I am wondering that should we actually start focusing on supporting and finding out what's happening in those countries where the rates are this low, because I'm afraid that there are some personal and family tragedies actually happening because of influenza. And of course, as is my job, I am thinking about the patients and families with asthma or chronic obstructive pulmonary disease. And we are very happy about the theme of today, because in fact, we find time and time again that healthcare professionals are the most trusted sources of information for patients with asthma and COPD. And this is maybe, as we heard also from the previous speaker, is an underused resource. How much of support do doctors, nurses, pharmacists actually have to play this critical role? And time again, we find out from our member associations that there is too little done by their governments when it comes to prevention. And now specifically thinking about vaccination and flu vaccination, influenza vaccination in particular. In fact, for patients, vaccination is really a personal health matter and a healthcare issue. It's not not only a public health measure. It really is a personal health issue, and that's why we believe that in their care, they are seeing their healthcare professionals regularly. This should be integrated into the care. And today we have more and more digitalization for follow-up, for appointments. So imagine a day when in your normal app that you have from your to connect with your healthcare professionals, you always receive this invitation for vaccination, regardless of who is at the end of the day, if there is a co-payment or whatever. So we need, as patients, we need some prompts too, because sometimes we also think that we are not concerned. So we need to have these discussions with healthcare professionals. Final thing is that we need to speak clearly and have transparent information, because in the people's everyday talk, flu and influenza, common cold, flu, all of these are mixing up. And it would be great if we could have testimonies coming also from the healthcare system, working together with patient associations on people and patients who have actually had influenza, and how it affected their health, and why they're never gonna miss their shot again. I have a lot of other things to share also, but maybe we can do that later. Yeah. Thank you very much.
Thank you very much indeed, Susanna Palkonen, for your intervention there. That's very helpful. So you're saying that vaccination is personal, not just public health. Professor George Griffin, from a public health perspective, though, it would be very interesting to get your thoughts, because as a board member and former president of the Federation of European Academies of Medicine, FEAM, another acronym, an internationally acclaimed public health expert, is vaccination a public health issue or a personal issue?
Well, thank you very much. I'm going to address both of those questions. First to say, I'm sure I'm not the only one who's had influenza. I caught it from a patient very, very early in the season who traveled from an area that had flu. I thought I was going to die. It is not a pleasant disease. Fortunately, I'm in pretty good nick and I survived, but I have never felt as ill in the whole of my life. To introduce myself, I'm a practicing physician and headed up an clinical infectious disease unit in one of the big London teaching hospitals and founded a vaccine research centre there and a biomedical research centre looking at human immunology. The three things I want to address today are, first of all, accessibility of vaccines. Second, research, which is still needed in this area. And third, a take-home message. And I'm going to say it now, but I'll say it again at the end. We forget influenza at our peril. It's as simple as that. Now, first of all, accessibility. I said I would use some personal examples. 2 weeks ago, I got an email from my general practice in London. Dear George, you are eligible for influenza and COVID vaccination. Please email to get an appointment. I emailed straight away. I got a straight away message back, no appointments. That is the state of general practice throughout the EU at the moment. So accessibility is crucial. And I can see a lot of people who would have that experience would just say, forget it. I'm not going to bother. Because I'm in the profession, I knew just what to do. I walked half a mile to my local pharmacy. I walked in. They said, fill these forms in. We'll give you the vaccination straight away. Without that knowledge, I might not be here today. That's all I can say. So accessibility is absolutely crucial. The second thing is research and what's needed. Well, research is on two levels. It's first of all in the public health level. We must have adequate data to tell us when an epidemic or then a pandemic is emerging and the type of influenza, its molecular typing, which is there. And if we actually have the vaccines which will combat that particular type. You remember H1N1 that came along. We were caught really almost unawares then. And that was the influenza that I caught from a patient, which was pretty awful, I can tell you. We need adequate public health resource information, and we have that potential within the EU. The ECDC in Stockholm is an EU organization which keeps records of just what is happening with all infections, and they can see influenza emerging quickly. And there should be rapid dissemination of information. And of course, in the EU and in other countries, pandemic preparedness is at the top of the agenda at the moment. HERA in the EU is an organization which has been going for nearly 2 years now in order to get ready for this on both a European and a global level. And then the last thing in terms of research is influenza vaccines. There are 14 vaccines altogether, a panoply of vaccines. Which are the best ones? Which are the ones we should be looking for in the future? And for a long time, one of the holy grails of influenza vaccination has been a pan-strain vaccine. And there have been all sorts of ideas. Now, I worked at NIH in the States for a short time on a sabbatical, and they were looking hard at a vaccine that this was several years ago, which is still not through yet, but a vaccine which would work and we didn't have to keep changing each year. So we still need proper research. We need education of healthcare workers, and we need education of the public. And we all know about anti-vaxxers at the moment. They're alive and well, unfortunately. And in some way, we have to be able to get round that. In terms of accessibility, I mentioned pharmacies. Now, I think we'll hear that in a moment. And that includes education of pharmacists about the vaccines that are available, about possible side effects, and how to give them efficiently. My experience has been Alpha Plus recently in the UK. Accessibility in hospitals. In my own hospital, 1,200 beds, the uptake of vaccination in nurses was about 25%. Together with the hospital, we had a blitz on getting vaccine workers onto the wards during coffee breaks, and we got the vaccination of nurses and doctors up to 75% within 1 year. So accessibility of the general public, but also of healthcare workers, is absolutely crucial. And then the last thing to say, of course, is vulnerable groups. It's not good enough to say we have a 75% vaccination aim. It's not good enough to say within some countries there is much less than that. We need to know the vaccination rates in the very vulnerable groups. And of course, they are the older people, the obese people, the diabetics, the people who've had transplantation. And they are the most vulnerable groups, and we should be aiming to make sure that they are protected. So if you remember nothing else from my talk today, and I'm sure, I hope you will, is just to remember we forget influenza at our peril. There will be pandemics. We need to look for them. We need to be able to respond quickly, and certainly quicker than we managed in my own country, in the UK, in terms of COVID.
Thank you very much indeed, Professor George Griffin. Thank you for your intervention. And you mentioned there about community pharmacists. Indeed, we have with us Ilaria Passarani, who is the Secretary General, Pharmaceutical Group of the European Union, PGEU. So what about that then, Ilaria? What about the role of community pharmacists? As George Griffin was saying there, it's a very important role in terms of the access to public to get the vaccination rates up. Over to you.
Yes, thank you, and good afternoon, everybody. Indeed, Professor Griffin's experience said it all. Accessibility is crucial, and the wide network of community pharmacies across Europe offer patients easy access to vaccination. In 15 European countries, patients can get vaccination in the pharmacy, and meaning COVID vaccination and flu vaccination. In 9 of these countries, pharmacies are able to vaccinate also for other type of vaccines like tetanus or diphtheria, herpes zoster, and other vaccines. And in other 3 countries, other healthcare professionals like nurses can vaccinate in a community pharmacy. And some countries like Portugal have a long-standing experience with vaccination, 15 years experience of vaccination in pharmacy, in Ireland as well. All those countries who have experience in vaccination in community pharmacy show positive results in terms of increase of the vaccination coverage, but also because of the accessibility and the convenience for patients. There is also a high rate of satisfaction from patients, and also patients who would not get otherwise vaccinated can get a vaccination in a pharmacy, and 1/3, for example, of the people who work in a pharmacy get the vaccination outside the, let's say, office hour of doctors. So the convenience and the accessibility is crucial, but also pharmacies have an important role to play as a trusted source of health information, as Emily and Susanna said. The 5% figures that Emily mentioned, it's a bit in contrast with the feedback we have from our members, who are the 32 pharmacy association all over Europe. And from the experience they get with the COVID vaccines, pharmacies were considered as a reliable source of information when it comes to the benefit and the risk of vaccination. And we see that our members are still willing to play an important role in also debunking myth and fighting misinformation in relation to vaccine and improving health literacy. But going back to the point that Professor Griffin said in relation to vulnerable groups, because of the large number of people that every day work in a pharmacy, pharmacies have also an important role in identifying and reminding target groups, including people with chronic condition and elderly population. So we see that also as an important role for pharmacies, together with the role they played with COVID-19, but they play in all countries, also where pharmacies cannot vaccinate, but they still play an important role in awareness campaigns. And once again, because of their geographically distributed present, all over Europe, they have a prominent role and visibility that can help in raising awareness and contributing to increased vaccination coverage.
Thank you very much indeed, Ilaria. Thank you very much. So we've had so many points raised here. It's fantastic to hear the ideas that are coming through about the urgency of this, about accessibility. We do want to take questions. So if there are questions in the room or they're coming in online, we'll try and take those. But I'd like to put a couple of points to all our speakers who I hope will join in here. Perhaps looking at that point about choosing to have the vaccination, perhaps Susanna, I could put it to you representing patients. Is the patient's choice paramount? If the patient says, I don't want it, I'm not going to go and have this, should that be respected or should something else come into play?
How are you going to do it by force? No, the thing is that Ilaria mentioned something about health literacy, and this is the positive way of tackling something that the question that you posed. And well, there is today still, at least in our disease areas, there is a much lack of self-management support for your disease. I'm talking about a personal self-management plan or even a general one that you could have at home, whether it's digital or otherwise, to manage your chronic condition. So I'm talking about patient education. So we have a lot to do there, and vaccination comes in there as part of that normal plan. And then we can, by involving patients in their own health, empowering them in this way, working together, we can change attitudes, we can change values, and we can have them as preachers to others also to have vaccination. Thank you.
So, any I'm wondering if there's anything you said, who sort of forced them. I'm wondering about some of the healthcare professionals themselves, because we hear statistics that even among nurses and among some healthcare professionals, they are themselves not vaccinated. So should that be mandatory? Should healthcare professionals be given incentives? Should they be paid? If they're paid, does that alarm the public that that's what the motivation is? Colin, what would you think? Should there be something a little bit more mandatory in terms of helping healthcare professionals themselves to come on board here?
You know what everyone really loves? Being told what to do. So in general, mandates don't work. And our experience in the Netherlands has been that if you mandate vaccination, it actually discourages it. And so to that end, I think that there is a much greater role of education and making sure that people make informed choices about whether or not to get vaccinated. There are reasons to not get vaccinated. They can be religious, they can be health, but there are very few other reasons to not get vaccinated. And so combating things like vaccine hesitancy, particularly amongst healthcare workers, is of paramount importance. If I look at my own hospital, for example, we don't have the best rate of vaccine uptake, and it's very disappointing. But challenging that is difficult, and it's one of the primary hurdles that we confront moving forwards. But I really think that, as we had recommended from the steering group, that we start with medical students, and we make sure that they have the best possible information so that the next generation of doctors is aware of the risks and benefits of vaccination.
Thank you. Yes, George.
Well, yes, I agree entirely with what Colin has just said. One thing that we haven't stressed enough is that you can protect yourself, but in doing that, you're protecting your family and your community. And that, I think, is a very important aspect. And we could emphasize that much more, particularly the family. If you have a family that all falls down with flu, that is tragedy. One last thing, Susanna reminded me, I should have mentioned respiratory disease, pre-existing respiratory disease in the high-risk groups, of course, as being important. And of course, I knew that, I just forgot to mention it.
Thank you. Thank you. Oh, and Emily, I'm wondering about, I just put a point to Emily, then come over to you. Thank you very much. About the hesitance that has been touched on so much. And Colin there mentioned some reasons for not wanting to have a vaccination, but there are others, whether it's a fear, or it's a phobia of needles, it might be cultural, it might be ignorance, for want of a better word. What are the key issues you think, and in terms of how those can be tackled? Because when the European Health Forum in Gastein last week or two had some really interesting discussions about new programs that would look at ways of tackling this, trying to be what they called doing an empathetic rebuttal, trying to have those conversations that are open-ended, not condescending, not judgmental. There are quite a lot of issues to unpick when someone comes and says, I'm not trusting this.
And I think that's one of the issues, is that there is no sort of magic bullet that will resolve this problem. You asked me sort of what are the reasons. It depends. It depends on where you are, which country, which culture, which community, whether this is religious group, whether this is pregnant women versus others. Every population will have different reasons. For influenza, we know that compared to other vaccines, it's not as much about safety as it is about perceiving the disease as dangerous and severe. It doesn't mean that people don't have concerns about vaccine safety. They're still there. But there's a range of factors. So ranging from, it's easier to accept a risk when you don't have to do anything yourself. So a passive risk that you sit there and you hope that you're not going to get the flu, it's easier to take that risk rather than taking a perceived active risk of getting vaccinated. So there's a whole psychological range of ways that people make decisions about vaccine. It's not as easy even for themselves to understand why they're saying yes or they're saying no. And I think that's why our responses really have to work around trust, in addition to addressing these in communication messages and having awareness campaigns, raising, increasing knowledge. Of course, that's important, but that's not going to be enough. If we really want to improve confidence, improve coverage in the end, we need to tackle trust. And that's working with communities, working with peer educators. If pregnant women are concerned about vaccines, have pregnant women talk to them about their own experiences. It's finding the link, the connection, and as you mentioned, the empathy as well. I think too often we're criticizing, we're pointing the fingers at anti-vaxxers, anti-vaccine groups. We have to be very careful about that language, because in the end, most of the people that we're looking at, that we're trying to convince, they're not anti-vaxxers. They're people that are like you and I, that just have questions about vaccines. Sometimes there's too much information out there. It's just impossible to make sense of it. And you just need help. You just need help from healthcare professionals, from your pharmacists, from your families, from your friends, trying to make sense of it. So I would say that's really the most important item. And that's where healthcare professionals are so important.
Yeah,
exactly.
Can I say something else?
Very quickly, George, because there's a couple of questions coming in from the floor and online.
The word vaccine hesitancy is lingua franca now. Actually, that's misleading. To be hesitant of having a vaccine is quite normal, in my opinion. You want to know about it. It's vaccine refusal, which is the real problem. You do not get the vaccine.
Thank you for clarifying that point. Question over here. Would you say who you are, please?
Thank you very much. Yes, my name is Dr. Daniela Lewald. I'm an associate professor in the School of Nursing, Psychotherapy and Community Health in Dublin City University. And I'm also chair of the International Council of Nurses, Nurse Practitioners, and Advanced Practice Nursing Network. So thank you very much for this really interesting discussion. And I'm, of course, delighted to see that nurses have been mentioned in the flyer and in the discussions today. And I think education is a really good point that you were mentioning there many times. And I think, I guess, number one, I have a question to the panel in terms of how you would see that nurses could be more influential in education. And I do wanted to, I guess, point out one thing that I'm observing is that there's no nurse actually in the panel, which is pointing me towards an idea in terms of maybe thinking about leadership as well. Because I do think as the largest group of healthcare professionals who partially are not vaccinated either, I think there's actually a lot of work that can be done within the group itself of healthcare professionals to maybe think about leadership, creating champions for flu vaccinations within the profession itself, but also obviously working with patients and their families in actually creating, more awareness and also answering questions, as you said quite rightly. So I think it's about education and maybe also about leadership and getting nurses on the table as well.
Thank you very much, Daniela. I'm going to bounce that away from the panel over to Bram Palash. You have some experience, I understand, with nurses in this way. Do explain to us.
Can you hear me? Yeah, okay. Well, in the context of what has been discussed today, the importance of influenza, the need for vaccination and the low vaccination uptake rates, and the need for education, I have been part of a project by the Dutch Influenza Foundation, which has developed an educational tool for nursing professionals. The tool is based on the ESNO Guide of Vaccination, which was published a number of years ago. But what we did is we translated the content, which was very good and very extensive, and we rehearsed a bit, and together with nursing professionals, we wrote a document in a number of chapters, and the chapters were basically the questions we hear outside by lay people, but also by health professionals. So each chapter is a question, and the content of the chapter is the discussion of that particular topic. So the document can be read in total, but for people who need have some specific questions of interest, they can read it. When it was finished in Dutch, we made it in English, and it's freely available for everybody who has an interest.
Thank you very much indeed. And perhaps we'll be able to pop that into the chat that people can see. We've got a couple of questions coming in. Isabel, it's over to you now. A couple of things. People want to know, Dr. Cassianos online asks you, why are the influenza vaccination rates from 2021 to 22 and 2022-23 missing from the ECDC report? What purpose does the old data serve? And perhaps you also take the question from Gary Finnegan, the 75% target set by health ministers. Does the council ever review the performance? Is there any accountability? So is there missing data and is there accountability?
Accountability, not really from us. I mean, we cannot punish anybody for not achieving the 75%. I mean, it's accountability to themselves. It was a council recommendation where the minister commit themselves to do something. Why they do if they don't intend to follow the recommendation? I mean, you need to ask them. But what we are doing, the accountability is that the ECDC is publishing the results. So you commit to do something, we check what you do, and we inform. And we inform country by country. So you can, everybody can see who is achieving the target and who not. But it's not a question of blaming, it's just to help to achieve the targets. And this is why we are having all these different projects to for the obstacles to vaccination and how to redress that. This is our answer.
Thank you very much. Ilaria, I wondered if you wanted to pick up on that, because representing the community pharmacists as you do on the front line, and then we're talking about policy at the other side of things. To what extent do you see it as a responsibility for those on the front line, the patients themselves, the pharmacists who deal with them, or would you be looking for guidance from above, from the EC and from national governments?
Health information is also impacted by culture and the different organization of the healthcare system. So I think that a bottom-up approach, it's maybe more effective, but also initiatives at European level, like the Immunion project, which has been funded by the European Commission, precisely with the idea of developing and facilitating access to resources for healthcare professionals on vaccination. Or easy tool like the one that has been just mentioned are very helpful. So a bottom-up approach in terms of the way you communicate, because it depends also on the patient you have in front of you, the healthcare professional that is working in for example, in a remote area or in a busy city, and then top-down approaches in terms of sharing of information, in terms of general guidelines that are very helpful. And with regard to COVID vaccine, for example, it was very important for all our members to be able to disseminate to their members, which are the pharmacists in the front line, validated information from the European Medicines Agency. So collaboration with the national authorities and the European authorities is very important.
Yeah. And I'm going to come back to the point about the front line and having access, a point George raised. Susanna, as from the perspective of the patient, if access is, as George, trotting off down with his 20 quid or whatever it was, down to his pharmacy to get his vaccination, what about taking vaccination to people, not asking the people to come to the centres? Could it be taken to communities, to schools, to churches, to places where people are? Is that what's needed to get that infiltration more into communities?
Any this kind of approaches really help a lot. And in some European countries, it is allowed that employers, for example, have this opportunity, big employers in their workplace, couple of days, anybody can come and take the vaccination. If this would be more generalized, I think it would make it indeed more normalized to get vaccination. But at the same time, it is some kind of medical intervention in any case, like Professor Griffin was saying, that people should think about it and should make their own decision about it. And some decide not to have a medical intervention for prevention because they are not ill, so they decide not to have a medical intervention. So we need to keep that balance also. And if I can add to what Emily was saying, we are also representing people with allergies, and they have often very justified and understandable questions about vaccines. That can they take them more from the perspective that I want to get vaccinated, and can I take it? Is it safe for me? And sometimes the percentage in the safety information, the percentage who will get anaphylaxis will not be enough. They need to discuss it and have some targeted safety information. I went.
That's helpful. Gentleman there, who are you, please, and what's your question?
Okay, I'm Bart Omen, Executive Director of the European Specialist Nurses, and I'm also very proud to be a member of this steering group. And I like it to really to be in the steering group because there's also some difference of opinions, and that really drives the discussions. So also here we have some new insights. I really appreciate that that our guide was taken up by the Dutch organization of influenza, and they created a very pragmatic guide, so very practical, and it's a good to have this also for nurses, that they don't have to go through thick books. But on the other side, our organization has deliberately chosen to have a bigger volume to be contextual, to explain first about the Spanish flu, what's really happening, and what is the first, what was the first vaccination, how does it develop, to kind of intrinsic motivation, and that's really what nurses want. So with support of Vaccines Europe, we created a survey. What nurses, what do you really like? And they said, well, we want to be a part of the puzzle. We want to be a part of the program. Make us a project manager. Also, as Daniela said, get us involved, because it's an interdisciplinary context. So sometimes we talk about the doctors and the nurses. We should avoid this. We have the professionals in the medical domain and the professionals in the nursing and care domain. So we need to have, maybe also for the future, maybe some some new conversation just to increase this number, because I was really shocked about the 5% of education, and I said, well, why is that policy or is that strategy? How come? Why are they not maybe facilitated? So there's a lot of questions for us for the next years when we are back here, and I'm really looking forward just to go into another year and just having also these kind of debates.
Interesting to hear about the best practice there and sharing examples. A question's come in from online. Perhaps, again, Isabel, it might be one for you. Can there be best practice sharing between countries at EU level in the area of vaccination? Can there be? Is there?
We are already doing best practices sharing. We have not only the Coalition for Vaccination, where the health professionals are sitting, including the nurses, but we have also the expert group on public health, where this is the aim, to share good practices among member states, and why or how a problem that has occurred in one country, an obstacle that has appeared, how another country has dealt with that, and can show what the instruments, what tools they develop, and how they manage to solve that.
And Colin, what about from your perspective, with all your analysis, have you seen good examples that you could hold up and say, this is a great way to do it, we should learn from this?
I think that one of the things that all of these discussions that we're having now very clearly reveal is that if our goal is to increase rates of vaccine uptake, it really requires multiple sectors of engagement. It involves engaging the patients, it involves engaging with policymakers, it involves engaging with scientists, and really creating a community dialogue about the importance of vaccination. And it's one of the things that our organization, ESVI, specifically attempts to do, because it's not enough for just nurses. Nurses are incredibly important, but they can't do it alone. Pharmacists are important, but they can't do it alone. Same for doctors and policymakers and vaccine manufacturers and everyone else. It really requires all of us working together. And so I think that's part of why meetings just like this are so important.
I understand that in the room we might have, are they tucked away around the corner there, some younger people? Strange creatures. If we have any younger people tucked away around there, who, I just wondered if you would talk to us about the social media, about fake news, about the influences that come in, and what influences you on social media. Is there anybody who'd like to speak up on that? If not, I'm going to turn to Emily, who's pretty young. They're all pretty mute. So, Emily.
I'm 70 years old, so I'm the new generation, sorry. But I'm very pleased that in our organization we have welcomed the nurse students, European Nurse Student Associations. And we are going to have an event in Milan next year. And it's very explicit to the student organization, but also the young generation nurses. So I really appreciate your question, just to talk to the younger generations. So, but we're doing a lot from our part. Yeah.
Thank you. We have got so much that we've already covered. I would like to ask each of our speakers to give their thoughts looking ahead as to what one key thing they'd like to see change, what would make a really big difference in terms of increasing that uptake. Let's start over there on the right. Isabel, what would you most like to see done that could make a big difference? What would you most like to see done that would make a big difference in terms of increasing the uptake of vaccinations?
Involve all the healthcare professionals and deliver the message.
That was very succinct. Colin.
I think there's many things, but one specific thing that I think is very important is that we make sure that all of our trainee nurses, pharmacists, and doctors are informed about influenza vaccination and about the information that they can ultimately share with their patients. Because I think the future generations will guide how we use vaccines into the future.
Thank you. And Emily, what do you see then as the looking ahead? What might make a difference? What sort of solutions would you like to offer?
So I'd say listen and respect patients. So try to understand where they're coming from, why they're hesitating, why they have questions, what these questions are. So focus on listening rather than telling what to do.
And would you like to just respond on the point about social media? Because it is one of the key factors when we think about vaccine refusal, as George puts it, rather than hesitancy, the influence of social media. How can that be tackled?
So I think, well, it is definitely, yeah, it's still on. It is definitely still one of the issues. We know that's how misinformation spreads. We know that it's been a very big contributor to the spread of misinformation around COVID. So it is something that we have to tackle in a certain way. But I would be careful not to think that this is the only problem. And I think we've clearly discussed a lot of the other issues going on. We know that there is currently a bigger problem with younger generations that are becoming less confident in vaccination, while the older generations are becoming more confident. So we are doing here, and I know this is for influenza, this might be just in a few years, but we're looking as well at people with chronic diseases. So it's not just the over 65. So this particular age group might be more responsive to campaigns that are online, that are through social media, but it's not the only focus of our strategy. I think it's part of the problem, it's part of the response, but it shouldn't be our sole focus.
And Susanna, what about from the patient's perspective? What needs to be done? What would you like to see? What solutions can you offer?
We would like to see that those vulnerable groups, especially for patients with chronic disease, vaccination becomes part of their healthcare plan. And the other side of that is that the healthcare professionals are supported to do that.
Thank you. I think they're all in violent agreement, unlike the steering group. We hear that they sometimes have differences of opinion. Violent agreement. George, have you got any great solutions that you'd like to see done? If I grant you one wish, what's it going to be?
Well, my first wish is that I can give two.
Oh, that's brief.
Very quickly. The first one I mentioned, accessibility must be improved. The second thing is, it's not good enough to say there's X% in this country and Y% in the other one. We need to know why there's only 2% in one country. Is it cost? Is it accessibility? Is it refusal? And when we know that, we can then start to effect change.
Thank you. And Ilaria, what solutions would you like to have magicked into existence now?
I would say make use of the wide network of community pharmacies across Europe, make use of qualified healthcare professionals, both to administer vaccine and to provide information to the general public on vaccination.
Well, thank you very much indeed. And thank you to all our speakers. It's been fascinating to hear so many different perspectives. Thank you very much indeed. We are going to hear now from our other MEP co-hosts, but before that, I'd like you to join me in thanking our fantastic speakers. Thank you all very much indeed. And now I'd like to welcome our other co-host, MEP Dolors Montserrat. Welcome, good to see you. You've heard most of the discussions and you're an expert on this and a great supporter of EU Flu Day. So thank you very much again for hosting us here, for allowing these discussions. It's been absolutely fascinating. I know we've only just touched on the surface of all the issues that need to be addressed, but what's your take on this? What's your perception of where we are now and how we can get to where we need to be?
Okay, thank you very much, Sue, and thank you. For me, it's an honor to be here and to host here this event with my colleague, the MEP from S&D. First of all, let me explain a little story that I really like to explain when I'm going to different events and the people is talking about the Spanish flu. Because you were talking about the Spanish flu and you know that I'm from Spain. So I'm going to explain a story that I think so that the people, they don't know. Why we are calling a Spanish flu. That flu was coming from Spain? I don't think so. So you know that, and I wanted to explain it because always I'm thinking, wow, you know, why we're calling a Spanish flu. But for me, it's proud because the Spanish flu arrives with American soldiers at the beginning of 1914. These American soldiers, they were in France, and the contagions start in France. But Spain, the media from Spain, they're the first ones that noticed what was going on France. So I'm happy that, it's not the Spanish flu, but the Spain medias, they put the point and the highlight what is going on at the beginning of the flu, of that, Spanish flu in Europe. So I wanted to explain always this little story because, the people has to know, because a lot of people, they don't know. Because today I have 3 messages, and one I have about misinformation and about fake news. So I wanted to link with this little story. But first, my first message for today. Well, you know that I'm a supporter of European Union Flu Day already for several years here in the European Parliament. But my first message is the enduring relevance of flu vaccination. So vaccination against influenza is a real cost-effective way of protecting people in Europe and making our health systems more resilient. Flu vaccination reduces infections and saves lives. Vaccination also contributes to doctors and nurses not being overwhelmed with patients suffering from flu-related illness that could have been prevented. No? In this way, healthcare professionals' precious time and resources can be freed up to deal, with other challenges. The European Union goal of 75% flu vaccination for at-risk groups is more relevant than ever. Every winter, we see again and again why it is so important to vaccinate against flu and other respiratory disease. And I'm so happy that here you are today with us. Indeed, last winter saw a triple epidemic of respiratory disease, including flu, which put considerable strain on our health system. So who knows what health challenge this winter will bring, and next year's winter and the ones after that. So this is why we need to do everything we can make it our healthcare systems as much resilient and sustainable as possible. Robust flu vaccination programs are part of the solution. So we have to work from the health public systems to going down, to arrive to all the patients, but to arrive to all professionals. The second is the essential role of the healthcare professionals. As we have here today, healthcare professionals can play a really key role in promoting vaccine uptake and increasing vaccine confidence. And always I'm saying doctors, nurses, pharmaceutics are trusted by their patients. And I'm going to put the example in Spain. You know, Spain, that we have a lot of rural zones, and we have a lot of demographic challenge, and we have a lot of old people living in the rural zones in Spain. So what they have, the first cross light on that they have, is the pharmaceutic office. And all these people, perhaps the first primary care, they have it in 40 kilometers away, and the first hospital, they have it 200 kilometers away. Perhaps 200 is so much, perhaps less. But this is the reason that it's very important to trust with the doctors, nurses, and pharmacists, because they are the first ones that the citizens they find. And for example, you know, I'm one of the defender here in Europe, the model of pharmaceutic office in Europe. Why? Because it's the first cross light on. And during COVID time, it was so important that cross light on. And when you were open that door of the pharmacy office, there are a professional. And the professional was explaining to that patient, don't worry, you don't have fever, they can do the first prevent test and give the first message, what to do and how to do and when to do. So for me, this second message is very, very important. Doctors, nurses, and pharmaceutics are very important in the flu vaccination. Because they are not just essential on the administration vaccines, but also in educating people, citizens, and how vaccination can protect them and the people they care about. I'm the one, you know, I'm a citizen and I'm not a health professional, but always I'm following what you are telling me. So if I'm going to office telling, well, today I'm not feeling well. I think that I have cough or something, I'm following them. Well, Dolores, you start to have fever, you have to go to the primary care. Then I will find the first person in the primary care. It's going to be your nurse. And then it depends on my disease and my situation. I'm going to arrive to a doctor. So this way, it's very important to educate, not just, to administrate the vaccine, also the education of our citizens on the flu day and the importance of the vaccination. So in this area, now I'm talking about the misinformation. So in an area that it's increasingly marked by misinformation and fake news, it is incredible that, we're in the century 21 and we have everything. We have artificial intelligence. We have everything in the mobile phone, in the in this tool. We have everything, but this is the reason we have everything. So for me, another big challenge that we have, it is the misinformation and the fake news. We noticed during the pandemic how many fake news and misinformation we found in internet. Or so here we have to fight against this misinformation and fake news with the European Union, and of course with all the national policies and all the state members. Because if we are helping in this way, we're going to help to the young people. And if we're helping to the young people is helping us. My son, he has 12 years old, and sometimes he knows more things than me on what happened that day. Mama, you know that yesterday happened this in some place. Well, I didn't know it. I didn't have time not to have it. So perhaps if we are fighting against this misinformation, fake news, we are helping all these young people to have a really good information of everything. And all these young people, they will help our families too. It's another channel of information. And if we are helping them to have a really good information, they will help us so much. For example, the young people, it's really, smart and fighters against the climate change, and they are helping us, another generation, to fight against climate change. So this is the same with the vaccines.
So, Dolors,
yeah.
Thank you. So come out on time. One more point.
And the last one. Finally, I'm so passionate. And finally, progress on boosting flu vaccination can be accomplished. I'm I'm going to mention the database of Spain has been able to boost flu vaccination rates in recent years from 54 in 2019 to 69 last year. So moreover, we know that flu vaccination rates vary widely by country in the European Union, from 7% in Latvia to 78% in Denmark. That's a tenfold difference. Progress can be made. So this difference, it's telling us that we have to improve a lot and we have to do it together.
Thank you very much indeed. MEP Dolors Montserrat, thank you. We've got to do it together. Got to do it together. I think that's the key message that's come out from all the discussions here. It's going to take a unified force to put into place all the suggestions that have come through. It's been fantastic to have these ideas from you all. Thank you very much indeed. The policy recommendations from the steering group are on the steering group's website. I know you all want to scurry away and check those out. Do go away too and add to your social media. No fake news, plenty of positive truth out there on #EUFluDay. It's been fantastic to discuss this with you all. There is a recording that you can look back at your leisure later, but please join me now. For now, thanking all our speakers and all our audience and all the delegates here in the room. And from me, Sue Saville, thank you all very much indeed. Thank you.
Well, piacere,
Piacere mio. Thank you for your words.
Dobbiamo lottare per offrire di farmacia, perché Spagna, Italia, Portogallo basta, loro non hanno, è molto importante, è una coesione.